Do you frequently feel tired for no reason? Or maybe you've noticed lumps in your neck that don't go away. These could be signs your lymph nodes are fighting something unusual, like in a condition called sarcoidosis. Sarcoidosis of the lymph nodes is when tiny clumps of inflamed cells, called granulomas, form in your lymph nodes. These nodes are like security checkpoints in your body that filter out germs. When they get overwhelmed or confused, they can swell and cause problems. Imagine a traffic jam at a toll booth. The flow stops working smoothly. That's what happens when sarcoidosis hits your lymph nodes. It's not cancer, but it can mimic it. And yes, it can affect anyone, even healthy people in their 20s to 40s. Good question. Scientists still don't know the exact reason, but think of it like a false alarm in your immune system. Your body thinks there's an enemy, maybe a germ, dust, or even something from the environment, but there isn't one. So your immune cells rush to the lymph nodes and bunch up into small clusters, granulomas. It's like your body's defense team overreacting and setting up camp where it's not needed. Some believe it might be triggered by things like mold in old buildings, bird droppings, or even certain jobs like farming or firefighting. And if someone in your family had it, you might be more likely to get it, like inheriting a sensitive alarm system. Now, how do you know if you might have this? Some people have no symptoms at all, like a quiet computer bug that runs in the background. But others might notice swollen, painless lumps in the neck, underarms, or groin. Imagine pressing your neck and feeling a small rubbery bump that doesn't hurt but won't go away. You might also feel very tired, like you didn't sleep, even after 8 hours. Some people get fevers for no reason, lose weight without trying, or sweat heavily at night, like soaking their pajamas. If the lymph nodes in the chest are involved, you might cough or feel short of breath, especially when climbing stairs. Remember, not all swollen nodes mean sarcoidosis. It could be a cold too, but if it lasts more than a few weeks, it's worth checking. First, they will ask questions and feel your lymph nodes, like a mechanic checking under the hood. Then they might order a chest X-ray or a CT scan, special pictures that show what is inside. If they see enlarged lymph nodes, they may do a biopsy, removing a tiny bit of the node to look at under a microscope. It is not as scary as it sounds, usually done with a small needle. Once confirmed, treatment depends on how bad it is. If you are not having symptoms, they might just watch and wait. If it is causing problems, they often use medicines like corticosteroids, for example prednisone, which calm down the overactive immune system, like turning down the volume on a loudspeaker. Most people get better with time, but some need long-term care. Can you prevent sarcoidosis? Right now, there's no sure way, because we don't know the exact cause. But you can reduce risks. Think of it like locking your doors at night. Avoid breathing in dust, mold, or smoke whenever possible. Wear a mask when cleaning dusty attics, working on farms, or near construction sites. Don't smoke, your lungs and lymph nodes will thank you. Stay healthy, eat good food, sleep well, and manage stress. If sarcoidosis runs in your family, tell your doctor so they can keep an eye out during checkups. Early detection is your best friend. Scientists are working hard to understand sarcoidosis better. Recent research found that certain genes might make people more likely to get it, like a software glitch in your DNA. New studies are testing drugs that target specific immune cells, so treatment can be more precise and have fewer side effects. Some researchers are even using AI to study lung and lymph node scans to catch the disease earlier. There's also a big focus on patient registries, real people sharing their stories and health data to help find patterns. This means better, personalized care in the future. All of this gives hope that one day, we won't just treat sarcoidosis, we'll prevent it completely.